Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
So I'm a contractor. I build things, and just started figuring out, well, several years back that it was really limiting what I could do. Used to climb through buildings, climb over buildings, climb in buildings, and walk job sites, and it started affecting how I conducted my work and how much work I could do, even in the office, getting up from my office chair. If I've been in front of the computer for a couple hours, I get up and I'm just stoved up in that left knee, especially during the winter. So knew it was time to do something about it, and then started kind of asking around about, you know, the who's and what's. Knew Dr. Lowry Barnes from just his reputation. He's got a good reputation for replacing knees, and so also I have friends in the medical community, you know, doctors who know of his work, and so he came highly recommended. So yeah, that was the reason why I chose him to take a look at my knee. He looked at it and told me what the other doctors have said over the years, that my left knee was a mess, and you know, and I knew that because I knew that eventually the knee was going to be replaced. I hate the fact that it happened when I was only 55 years old, but I figure I'll have some good years, you know, with a good knee. So I had the surgery at 10 o'clock yesterday morning. And let's see, I think I'm scheduled to be out of here in about an hour. So I guess from the time I had the surgery, a little over a day. So we're real pleased with that. Obviously, there's no place like home, and felt really good. Haven't had a lot of pain. Dr. Barnes is doing some new pain thing on the leg, and which is non-narcotic. I haven't had any pain pills since I got here, and it just over a couple of days, this pain treatment kind of numbs or deadens the nerves or something in the knee. But it's been phenomenal. I couldn't believe how little pain I have, and so yeah, I'm ready to roll. I attended the Joint Academy class, and so they kind of orientated us on what was coming and what we needed to do and how to prepare, and then also what to do afterwards. I've always been active, so over a period of years, I went from being a runner and a basketball player, tennis player, couldn't do that, to just running, can't do that, all the pounding stuff. Then I started riding bikes and did that for 15 years, and then got to the point where I couldn't do that. So then I started swimming. Swimming is great, and I thought, wow, this is it. I'll be able to do this from here on. And unbelievably, my knee was so bad that I had to quit kicking. I had to use the thing between my legs, so all I was doing was pulling with my upper body. So I just getting back to doing things that I love to do, being active. I don't want to wear out my knee, but but playing golf and doing those kind of things are the things I'm looking forward to. I'm really not having any pain right now. I've got it straightened out right now in a demobilizer. People do the 1 through 10 thing. I guess I'm 1. I don't know. It's
so
just
the rating scale.
On the rating scale, I guess I would be a 1. Yeah, it's just you know, and as I press on doing my physical therapy and doing things, yeah, you know, I feel it then, but it's no pain, no gain, I guess. Yeah. Well, this little pain trick that Dr. Barnes did was pretty phenomenal. You know, I felt like I'd bounced back pretty good. I'm in good shape. I can't believe I'm this lucid right now, and I was yesterday. In fact, they had some steroids in one of the shots, and so last night I'm just kind of kinetic, and I'm like, oh, I'll never get to sleep. So I was in a great mood, and I woke up. I slept well last night, and this little pain trick. The knee I know is going to do great. He said Dr. Barnes told me that it was a highly successful surgery, and felt really good about our outcome. But just the experience of the surgery has been pretty wild. I'm going to go to the office this afternoon and push a few papers around, and then go home and take a nap. So yeah, not bad for surgery yesterday. It's been a surprisingly easy experience for me, yeah, it's been a good place and a good procedure and a good environment, and ready to go home. Yeah.